You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Greetings, everyone, and thank you for joining us on this episode of Public Health Entrepreneurs. My name is Dr. Huntley, and I'm your host. I'm a public health entrepreneur with over 20 years of experience in public health and healthcare, and I've supported a lot of entrepreneurs along the way. Now, on this podcast, we talk about all the topics of interest at this intersection of public health and entrepreneurship. Now, usually it's just me sharing on different topics or answering questions, but occasionally I invite a guest to the podcast to just talk about their journey and share for a point of inspiration. So right now I am joined by Judeline Casimir. Hi, Judeline. How are you?
Hi, I'm fine. And yourself?
I am good. I like that we're matching today. So if people are seeing the video, we are matching. And it's funny, I had on this gray outfit and I wasn't going to put on the blue blazer. I thought about it this morning. And then she jumped on camera with her blue blazer. I'm like, well, I'm going to wear my blue blazer. So I love that we get to do that. That's right. I am excited to have her on this episode because she represents that early phase of entrepreneurship, and it's filled with all sorts of challenges and a lot more questions and answers as, you know, you're getting started on the journey and so forth. So I am excited to have her here. So we met, our journey starts way back. We met when she was a student in a course that I taught. And then she followed my other podcast, Public Health Epidemiology Conversations, and showed an interest in entrepreneurship. And she's attended the expo. We met in person. She joined my retreat in person, and she's been a part of our mastermind group program. And I'm just excited to watch her grow and to help and support her along this journey. So I've given, kind of my introduction of you on this episode. But Judeline, why don't you introduce yourself and tell us about your business and also the name of your business and who you serve?
Yes, my name is Judeline Casimir. I'm the CEO founder of Kazimia Public Health Empowerment. A consulting firm is dedicated to promoting health equity and conducting community health research. We serve a diverse range of communities focusing on understanding their unique health challenges and working to drive positive changes toward their well-being. Primarily, I focus on the migrant community because I'm a migrant myself. And right now, with the migrant crisis that we have, they need all the help they can get in the public health sector.
I am glad you added that in there because I was about to. I think that your passion in this niche it resonates and it stands out. Not only, it's very common, and I've coached a lot of entrepreneurs, it's very common for us to get started either with something that we're really good at, like a skill set that we've come from, our other jobs, and we decide we're going to start a business with this, or from something that's more personal, a personal challenge, or something that's we're connected to on a personal level. And whenever that happens, I think that, that personal connection, I think that is a really strong passion, leading with a strong passion. I think that resonates and will connect with the clients that you have as you move throughout your journey. And for your case, being an immigrant and then also seeing this crisis. So you are bringing such important lenses, not your own personal perspective and lived experiences, but then also your public health professional experience and that lens and that education and background. So those are important qualities that make you so unique.
Thank you.
I remember those conversations and, early on when you were trying to decide where do I start? What do I do? And like a lot of people, you could have chosen a lot of different things because we do a lot of different things really well. But really, this was such a strong place to start because the organizations that need the support that you can offer really are going to appreciate that perspective and those lenses that you bring.
Yes, thank you. I appreciate that.
Yes. So let's kind of go back a little bit. Some of my questions just kind of help frame the journey. And again, it's kind of inspiring. I'm hoping that this is inspiring for our listeners as they think about, again, similar situations, you can do multiple different things. How do I, kind of frame this up and get started? But also thinking and understanding what you do. So if our listeners are thinking, well, I know of some organization or, there's a need for someone like, Judeline and the skill set she brings to helping serve immigrant populations. Well, we're going to make sure that you are able to connect with her by the end of this episode. But let's talk a little bit about your journey. So when did you first become interested in public health as a career?
Oh, let's go back to my childhood. I was born and raised in Haiti, where I first then experienced the public health crisis. Some of the things that I've experienced is the lack of clean water, sanitary facilities, preventable diseases such as typhoid, malaria, intestinal worm. And I was always curious to know, like, what makes this an issue? Growing up, every time I get sick, my mom takes me to the hospital. I came back with one of those diagnoses. And I could not understand what it was. And that drive me to understand what was it that was going on. And how can I address this? What can we do to make it better to help these people? Because I'm pretty sure, because you go to the hospital, they give you a prescription, then you're fine. So there has to be something that we're doing wrong. And eventually that led me to public health. And now I'm serving my community and also have a master's in public health, a master's degree in public health.
That's amazing. That's incredible. Now, I'm curious, at what age did you immigrate from Haiti?
I came here when I was 21.
Okay.
And I did my undergrad at Northeastern from healthcare administration. And when it was time to do my master's and I found out that I can get a degree in public health, I was like, sign me up. So
that's really interesting because you spent like your childhood and up to adult age in Haiti, and so much of what, you're able to remember so much of that. It's a very pivotal time. Then when you were going through your public health education, I can just imagine how many times you were having aha moments as you're learning things and probably thinking about how you could serve back in Haiti. Is that some of that happening?
It did, because it all started actually when I started doing education back in 2017. So that's when I started serving these communities in Haiti, those young women that I do community public health education with. So we educate them on various aspects, such as feminine hygiene, cervical cancer, how to prevent, how to take care of themselves. And then it was at the same moment that I signed up for my master's in public health. And then we go in here. I'm like, oh, okay, I think I'm in the right path. I think I'm in the right field. I think I'm doing the right thing. And here we are today. I'm still serving these communities when I have time. I still help them. We still have our groups. I used to do it every Sunday where we do it via Zoom. We just tell them whatever. I have the presentation and they ask me questions that I answer to the best of my ability, because I'm not a doctor. Some questions are for doctors, but some like little things that I can help them with, I help them. And the rest is history.
That's amazing. And I don't want you to kind of miss the significance of that, because it comes very naturally to you that you're able to connect with your own community. You're able to share this information, educate. There's trust there, and they're committed. You pretty much can say this, meet me here at this time, and they're going to show up. They're going to log in. They're taking that information. You have to remember that organizations are really wanting to connect with communities in that way, and don't have that ability. You don't just show up and say, because this community needs something, that you show up and say, here, this can help you, and they accept it, or, make assumptions about what they actually need without engaging with them. So what you're able to do is really strong. And I'm making a big deal of this right now because I see this often. And entrepreneurs, we forget sometimes we're really good at something. If it's a talent, a gift, a calling, and it just comes so easily to us, we can easily downplay it and miss the importance and the significance to other organizations who need that skill set or that connection to community. So that is something that I'm speaking to you directly, but I'm also speaking to all of our listeners. It's something that, when it comes very naturally to us, and it's, easy for us in a sense, the communications piece, especially your ability to build trust and have that trust level, it didn't just happen. There's something you did along the way over time. There's something about you that helped you connect. So those are strengths. Those are assets for your business. So just remember that.
Thank you. Yeah, people like to resonate with you, especially if you speak the same language, you have the same skin color, And you
Yes.
can speak the language fluently, meaning you understand where they're coming from. You understand their upbringing. And I remember one of my projects that I did for the COVID-19 vaccine hesitancy. So I did a survey. And when I went out to those communities, I used to go every Saturday and Sunday at the flea markets where people are. And then the connection, the passion, the love was there. And it drives me to do it and do it over and over. That's what led me to community health research, because I can connect with these people. They trust me. They can open up to me. They can tell me what they're going through, what their fears are, their concerns, their desires. So it's amazing to connect with the niche that you pick and you feel like you choose the right option, you're doing the right thing. It's an amazing feeling.
Yes, absolutely. So what about, when you think about your previous experiences, work experiences, how has any of that previous experience helped you prepare you for this journey of entrepreneurship?
I've worked with several health centers around the Boston neighborhood, and most of them, they serve the Haitian population, they serve the community. It really shapes me to know how to address these people. It shapes me to know how to get into their mind, and I know their needs. I know what they're looking for. And knowing what the community you serve is looking for shapes you to be a better entrepreneur, because you know exactly what to put on the plate to serve them. And that's a big plus.
Yes. I think that's wonderful as well. And that's also, something that I'm glad that you highlighted that, because that could be overlooked and as, that's just something I do. But no, that's an important, and you don't always realize these are like strengths as you're learning, as you're going through whatever the job is. It's only kind of in hindsight that you really can see the value, right?
That's true.
Yeah. So what about your business? A lot of entrepreneurs will start their business while they're working another job, and then some are full-time in their business and that's what they do, or some combination. So I asked this question because I think it's helpful for people to there's no right or wrong way to do it. I know people who have just ripped the Band-Aid off, gone in full-time, or by circumstances are in full-time with their business, or like myself, I worked my full-time job, started my business and didn't even know where I was going with it. And then after a while, when it evolved into what it was, turning into and the opportunities were growing, I ended up leaving. So there's a lot of different paths. I'm curious for you, do you operate your business full-time, or do you work another job and operate your business?
I do work another job and operate my business. I do work another job. It's essential for me right now to have that sense of security as well. Because, in business, things could be uncertain and we have to make sure we have the sense of security. But my goal is to eventually move full time, and we're working towards that.
Wonderful. Now, here is where I want to hear your, the best and worst, so to speak. Thinking about consulting and entrepreneurship. And I had a podcast episode, 2 episodes at the very beginning, that really explained the difference in entrepreneurs and consulting. So entrepreneurs, like the umbrella, we're all entrepreneurs. Consultants are a type of entrepreneur. But anyway, I wanted to just preface that. Go back to the episode 1 and 2, I think, explains those in great detail if you're curious to hear the whole thing. But with that in mind, what do you like most about consulting and entrepreneurship, or this journey of entrepreneurship?
It's the ability to make your own schedule, to make your own choices, and the ability to choose the people that you work with. So that's the part I like the most about it. It's incredible. When I started this journey, I'm like, oh, I can do this, I can do that. Like when I go to your expo, I can just get up and go. I don't have to give nobody an explanation. It's the flexibility that comes with it. It requires a lot of work. I'm not going to lie, because I can't just get up and go to the beach right now because I want to, It requires a lot of commitment, but you have a leeway. That's why eventually I want to go full time, because I see the perspective. I see the bigger image further than I'm like, oh, I can do this. I can do that. I can do this. So it's wonderful. It's wonderful. It's a wonderful feeling, and I'm loving it here.
That's one of the reasons I use a phrase often on this podcast in work that I do in supporting entrepreneurs to build the business of your dreams. Because it comes down to what we want, the kind of clients that we want to work with, the kind of work that we want to do, the kind of schedule we want to have.
Yes, the schedule.
So Yes. All right. So in that same vein now, let's flip it over and tell me, what do you like least about this entrepreneurial journey?
The uncertainty that comes with owning a business. There's always challenges, like I mentioned before. And, you got things to do and you don't know where your next client's going to come from, or you don't know how this project is going to turn. So you have everything lined up, but you don't know how things going to turn in a long way. Or if you, for example, you're working on this project, then it's about to end. You don't know when your next client's going to come, or you don't know what the next client's going to want if you already have one lined up. So these are just the uncertainties. This is the part that I don't like about it.
Yeah. Oh, I understand. And I'm glad you mentioned that, because that's a real challenge we all have to face and adjust to. But it also leads us to sometimes helping to decide what to say yes and what to say no to as we're building our business, because, we can start to build in. I don't think there's anything that's all the way secure, because even when you work at a job, you never know how many times if you've heard of, or maybe even been in situations yourself where the company shuts down or anything can change and your job can be history at any moment. So there is no true security, right? There's no real true secure opportunity there. But as an entrepreneur, as a business owner, you really are having to think about those things and build your business in a way that you can create those securities, I guess. And, as much as
challenges,
possible. So
those challenges definitely leaves room for growth. Because when you're faced with them, you have to know how to navigate and how to find the next solution. So it's definitely worth it.
Absolutely. It definitely a real challenge.
Yes.
All right. So one more question for you. And this one, I really love hearing responses here, because there's this level of creativity that we bring as entrepreneurs to this very scientific field of public health. So in what ways are you advancing public health with your business or through your business?
So through my business, firstly, we conduct public health research, which is a big plus because you get to collect the data, you get to know what the population wants, and then you go and serve them the way they need to be served. And then the second way I do this, like I mentioned before, I'm a public health educator. So I love educating people and leaving them with the knowledge, with the information that they need to take the next step. Know what to eat, when to eat, know what question to ask when they go to the doctor, know how to advocate for themselves. This is a big plus. I'm really a big advocate about asking the right questions, especially when the language is your second or third language, because everything could be lost in translation. What the doctor means, not what I perceive. So I always tell them, if you do not understand, bring somebody with you, ask the right question, or the next time schedule another appointment or get a second opinion. So I'm a big advocate for that. And I think that helps me also be a better person, be a better entrepreneur, because while I'm teaching people what to do, it also sometimes you have that big aha moment, hey, I haven't done that for myself, or I need to do this more, I need to do this. So these are the ways, by collecting the data and also make sure that the public that I serve is armed with the right knowledge and questions and things that they need. So that's what we do.
Nice. Yeah. I am a huge fan of what you do and how you show up for the population you serve. So I appreciate your time here. We will provide links to connect with you in the show notes for this episode. So everyone who's listening, I encourage you to connect in. Also, not just connect with Judeline. I'm going to really throw out LinkedIn because that's a great platform to be connecting with. But I'm also going to ask that you think about your immigrant populations in your area. Who can you connect her with? Or maybe it's an organization that you are leading that could benefit from her services as she's getting started and really building up and growing her clientele. I want to encourage you to connect with her for opportunities, or maybe introduce her to someone that you know that where she can serve. So
thank you.
I will leave you with that.
That was
Judeline, thank you so much.
Thank you so much. Thank you for having me. It's always a pleasure being with you.
Absolutely. Same here. I enjoy being able to support you and watching your business grow. And I can't wait for the next update.
Yay, me too. I'll keep you updated.
All right. Take care.
Take care.
Thank you for listening. Visit publichealthentrepreneurs.com to learn more.